Are you implementing these 5 helpful tips into your virtual patient visits? COVID-19 ushered in a lot of challenges for us all in 2020. However, one of the positive advancements that came from the pandemic is increased telemedicine services. Pre-COVID-19, only 24% of healthcare providers offered these services. Today, that number has nearly doubled. If you're one of the many healthcare providers who now offer telemedicine services, stay tuned because this video is for you. I'm Sissy with Jotform, and today we'll discuss 5 helpful tips you can implement to boost your telemedicine practice. Let's go! Although a lot of the technology and necessary infrastructure to offer telemedicine services existed pre-COVID-19, many healthcare providers avoided offering them for one major reason. Many insurance companies didn't cover this service. However, due to the pandemic, the Centers for Medicare and Medicaid Services updated their requirements so that virtual visits would be covered. After that change, many healthcare providers opened their services to the virtual realm. So, if you're part of the virtual healthcare services world, here are 5 tips you can use to ensure your visits are a positive, helpful, and an informative extension to your in-person healthcare practice. Our first tip is to invest in good equipment. Whether you're Zooming with colleagues or FaceTiming with your niece, nothing makes a video call more frustrating than a poor quality video stream. This is how miscommunications occur, so investing in good equipment is beyond important. Set up your camera at eye level. This makes it easier to maintain eye contact with your patient, putting them at ease and making engagement easier. When it comes to sound, your computer will likely have a high-quality camera with a built-in microphone or speaker, so you won't need to purchase any additional equipment. Now that you have your equipment ready to go, make sure to test it before meeting with any virtual patients. Give your friends, family, or colleagues a test video call. How's your sound levels? Do you need to move closer to the mic or camera? Are there any other interfering audio issues like background or street noise? Our next tip for enhancing your telemedicine services is to set up a dedicated space for your virtual practice. If you're on the go, at the office, or at home, it's important to dedicate a space for conducting virtual visits. Perhaps it's an empty exam room, your home office, or a quiet part of your house. Regardless of where you're working, you'll need to have the appropriate equipment handy as well as good lighting and somewhere quiet where you'll be undisturbed. Especially with patient-doctor confidentiality, the last thing you want is someone interrupting your sensitive appointment. Along with having the appropriate equipment and finding a dedicated workspace, you must be able to ensure network connectivity. Connecting to Wi-Fi will work in a pinch, but a more long-term solution should be plugging your computer directly into a wired Ethernet cable. You're less likely to lose internet connection that way. If you're not using a computer, but are using a mobile device instead, connecting to the Wi-Fi in your home or office will work. Just make sure that the Wi-Fi you're using is a safe and secure connection. One of the best ways to streamline your online virtual visit process is to use online intake forms. Collect the necessary new patient contact information and medical history prior to their visit with one of Jotform's online intake forms. This way, you can gather crucial info, register the new patient, and be up to speed, all before your first video call. Jotform's forms are safe and secure and completely customizable. You can change everything from the layout and form fields to the color schemes and company logo. You can also add terms and conditions as well as request e-signatures for informed consent forms. Jotform also has you covered when it comes to being HIPAA compliant. All you have to do is upgrade to the Jotform Silver or Gold plan. Nobody likes abrupt endings, so be sure to explain the steps going forward after your virtual appointment. Make sure they know the next steps they will need to take, whether that's picking up medication or scheduling a follow-up appointment or waiting for a follow-up call. Just because they're meeting on screen doesn't mean they don't deserve the same personal touch you'd give to in-person patients. Providing insight into what's next for the patient is the same as saying, "I'll check in to see how you're doing next week." Your courtesy and care will go a long way. If you have a first-time virtual patient, you can solicit feedback on their experience. You can ask a few simple questions face-to-face or screen-to-screen, rather. Or you can send them an online patient satisfaction survey after your appointment concludes. Then you can use this info to improve your virtual practice. The coronavirus may have kicked telemedicine offerings into high gear, but it will surely stick around long after COVID-19 is no longer a health issue. If you implement the tips discussed today, you'll be setting your telemedicine services up for long-running success. Let's do a quick review. If you offer telemedicine services, here are 5 tips that will enhance your virtual visits. First, invest in good quality equipment and make sure to test them with friends, family, or colleagues. Second, set up a dedicated space at work or from home that will aid in conducting sensitive video calls. Third, make sure your network connection is great, either using a secure Wi-Fi connection or plugging in directly with an Ethernet cable. Fourth, utilize online intake forms with Jotform. This way, you're ready to go before the meeting even starts. Fifth, explain the next steps for after your video call. Ensuring your patients know what to expect after the appointment ends is good practice, whether you're in person or meeting via video call. Until next time, I'm Sissy with Jotform. Thanks for tuning in today.